I'm Natasha Lubchenko with today's CT Style Express. The COVID-19 pandemic has impacted so many of us in terms of mental health and stress, and studies now show that in adolescents, substance abuse is on the rise because of it. Joining us to talk more about this and how we can tackle this issue is Trudy Hewell. She is the program manager of children's services at BHcare, a behavioral health clinic here in Connecticut. Hi, Trudy, welcome.
Hi, Natasha. Thank you for having me.
Of course. So let's first talk about some statistics here. How many teens are turning to substance use as a coping mechanism? Is there an increase pre-pandemic to now?
Yes, I think there's definitely an increase pre-pandemic to now. In Connecticut alone, we're seeing where 8.9% of teens between the ages of 12 to 17 are reporting drug use in kind of like the last month.
Wow. And so what can we do to help these teens find healthier coping strategies? I know you have some resources for families at your center.
Yes, so BHcare Today's Choices program, it offers a comprehensive evidence-based program for youths between the ages of 13 and 18 who are struggling with substance use and/or at-risk behaviors. Through this program, youths can learn how to use coping skills to kind of replace the maladaptive coping skills they've kind of leaned towards. So substance use to kind of cope with many stressors, whether it's depression, anxiety, just the ongoing pandemic. So in this program, kids are kind of really learning triggers, how to identify triggers to their feelings and, what typically leads them to using the behavior. And then we try to replace those negative use behaviors with more positive behaviors.
And I know you say early intervention is key here. Why is that?
Because, what we have seen is that early intervention can kind of prevent further substance use in adulthood. So the more kids can kind of really understand how substance use impacts their overall level of functioning, the better they will be able to kind of, manage various different life stressors as they get older.
Absolutely. And so you offer these skills and lessons for the adolescents, but you also have tools for families and the parents that are helping them navigate through this time as well.
Yes, correct. Our program also involves the parent piece for parents that kind of understand the struggles that their children may be facing. So a lot of times this program is really geared towards increasing positive interactions and communications between parents and children. It also teaches parents some warning signs, some early warning signs, and how to kind of listen to your kids and what signs to look for.
So important. And if families think that this might benefit, their teen, how can they learn more? And just talk to me about the structure of the program. Is it a daily program, a weekly program?
So our program is a twice per week program, and it runs for typically an hour and a half. We have an individual component that also includes the parent piece. And then we also have a group-based component where kids will be placed in a group with peers their age that are struggling with many different or similar things as they are. The program typically runs for 14 weeks, give or take. We also kind of really like to use a person in their environment perspective. So even though it's kind of 14 weeks, it can go as long as the treatment is needed.
Great.
If families are interested in seeking services, they could definitely reach out to us at www.bhcare.org for more information.
Wonderful. And Trudy, one closing thought here. What message do you have for families and teens going through this? It's a very difficult time, I'm sure, for many people. So what would you say to them?
I would say to families and teens that, if you feel as though you are leaning towards substances to cope with everyday stressors with the pandemic, depression, anxiety, definitely reach out to us for services. Early intervention, as we mentioned, is key. Families should kind of look out for, isolating behaviors, changes in any of the behaviors that, kids used to do, but now they don't do anything. Those are kind of like, key indicators. So definitely reach out to us. We're also available to, talk with families if they suspect or if they feel as though something may be happening. They can definitely reach out to us as an organization, and we can process and talk with them through what the next best steps would be. But definitely, don't take it lightly.
All right, really important work that you're doing. Trudy, thank you so much for your time today and for the valuable information.
Thank you.
All right, and again, for you guys at home, that website is bhcare.org for more information. For CT Style, I'm Natasha Lubchenko. Have a great day.